Welcome to my channel again. This is the Prairie Nurse, and I'm going to be discussing Marburg virus. That's been in the news quite a lot lately, so let's get down to the facts. Hi, at Prairie Nurse, we want to discuss the disclaimer. All information shared, written, or verbal of any kind with Prairie Nurse is for entertainment purposes only. This is my only opinion or knowledge that I have researched or creatively thought of and want to share with others. Please advise with your medical doctor for any medical issues or concerns of any kind, especially if you're pregnant or have chronic or acute issues. If there's an emergency, of course, contact 911, or if you live outside the USA, contact your emergency services. Information in science can and does consistently change. By the time you review this information, the medical world may have changed or updated their information. Please go to your medical provider, medical government websites, or medical journals for the newest information. All right, let's get started. What you need to know, first, the virus is from the Filoviridae family. There's many other viruses underneath the same family. You can go ahead and take a look there. And of course, Marburg virus is part of it, and Ebola virus. Where did this awful virus come from? Well, the first outbreak was in Marburg, Germany, back in August of 1967, as well as Frankfurt, Germany, Belgrade, and Yugoslavia, so around the same time period. Who got infected? That was multiple lab workers, and this was traced back to monkeys that came from Africa. They're being transported to these labs. How can you get this virus? Well, direct contact with an infected person's body fluids. The virus enters the body through skin breaks or mucosal membranes, blood or bloody fluids, which is urine, saliva, sweat, feces, vomit, breast milk, amniotic fluid, and semen of a person who is sick with or died from the Marburg virus. Objects contaminated with the body fluids from a person who is sick with or has died from MVD. That includes clothing, bedding, needles, and medical equipment. Semen from a man who has recovered from MVD. Data on Marburg viruses is limited. However, they are known to persist in the testicles and inside the eye, similar to Ebola viruses. Since Marburg viruses and Ebola viruses are both in the same type of family, it can be assumed that the persistence of the Marburg virus in other immune privileged sites, such as the placenta and the central nervous system, may also be similar. However, there is no evidence that it does spread through sex or other types of fluids from women. All right, what is this nasty virus doing inside your body? Why are you feeling so crappy? Well, the virus attacks your monocytes, your macrophages, and your dendrite cells, which leads to huge issues with your liver, lymph nodes, and spleen during the early process. And then that triggers an antigen-presenting cells to cause a huge inflammatory response. And then this inflammatory response then triggers and cascades a large amount of abnormal blood clotting throughout their body, which leaves devastating effects. Signs and symptoms of MVD. The incubation period is 2 to 21 days. Symptoms will come on suddenly. Fever, chills, headache, and malaise are some of them. Around the 5th day, you could have the specific rash, most prominently in your trunk, which is a chest, back, stomach may occur. Nausea, vomiting, chest pain, or sore throat, abdominal pain, and diarrhea could also appear. Again, symptoms increasingly become severe. Other signs can occur, which is jaundice, which is illness to your skin or your eyes, inflammation of the pancreas, severe weight loss, delirium, shock, liver failure, massive hemorrhaging, and multiple organ dysfunction. The signs and symptoms of MVD, also because of the type of virus it is, it's in a large family of virus, so it could be related or to be defined as malaria or typhoid fever, viral hemorrhagic fever, and Lassa fever or Ebola. So infection disease doctors may have a hard time finding the diagnosis if that is what you have, if it's MVD or something else. According to my statistics that I have been reading for my references, the case fatality rate for MVD is between 23 to 90%. That's a huge difference. So let's be more hopefully on the 23%. That is the lowest percentage of case fatality. Yeah, so that is what I've been finding. Again, like I just said, for my references, diagnosing MVD is very difficult because the signs and symptoms are closely related to so many other viruses in this category. They do have a few types of different testing. I'm not familiar with these testings. This is just what I found in my reference. So I do not have any opinions on it, but I'm just giving you guys the information from the CDC website and medical journal. So here's the list. We have ELISA testing, also what you probably heard of before, the PCR testing, IgM, capture ELISA testing can confirm a case of MVD only if you can catch it in the first few days when your symptoms start. Another way is a virus isolation is done in high contaminant laboratory with good laboratory practices. So depending on where you live, this may be an option. The IgG capture ELISA is appropriate for testing persons later in the course of the disease or after recovery. And the last, this is basically just to find out what happened to the person that was deceased. These are the other options that they would have listed here. Surprisingly, for Marburg virus treatments, there isn't much out there. I was very surprised by this, especially since it's been known to be around since August of 1967. So what I found is that there's no specific treatment for Marburg virus disease. Supportive hospital therapy is utilized, which includes balancing the patient's fluids and electrolytes, maintaining oxygen status and blood pressure, replacing lost blood and clotting factors, and treatment for any complicating infections. So again, I'm quite surprised by this and saddened that since August of 1967, we haven't done anything more than just being supportive. Here are my references and sources that I found this information from. This is fall of 2023. So of course this may have changed and updated due to science is consistently changing. Again, this is the Prairie Nurse. Thanks for visiting my site. God bless, and subscribe and like if you like my information, and you can check out other ways to reach me, and at prairienurse.com I have a great blog there with a lot of health tips, and also I have recipes. All right, well thanks and have a great week.